Good evening, everyone. I'm AnnMarie Cronin, and welcome to our live weekly medical show on 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre-screening and simple non-invasive tests can actually prevent Alzheimer's and many other chronic diseases. If you have any questions, we're opening up the lines and taking your calls, so please make a note of this number, 800-859-0957. Again, that's 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to 760 WJR. Are we on Facebook?
Yeah.
Okay, great.
So, it's too bad that Siobhan's not going to be on to talk about that horrible experience she had with the urgent care. But I think all the urgent care places are just as bad.
Well, I don't know that you can put all the urgent care places in one lump group, but she definitely had a bad experience. You want to tell the Facebook listeners what she went through
Apparently
today?
that she had a reoccurrence of some swollen glands, and then something was, was affecting her, I guess her eyes, and she needed to see somebody, and called Dr. Kolender, and he said, go to urgent care.
Now, keep in mind, normally we would see people, but
Well, she's in
Milwaukee
in
on
Milwaukee.
tour.
Right.
So, when somebody calls with a recurrent problem, someone needs to lay eyes and hands on them.
Right, you have to be seen.
Because now we're in an unusual situation. So I asked her to go to an urgent care to have someone look at her at least, not knowing what would happen. Then, what happened after that?
So then she called me, and she goes to an urgent care, and there's no MD there. There's no doctor there, which is one of the reasons why I don't go, and I advise my friends not to go. And that's a whole nother story about why you don't want to be paying that kind of money. She was asked to pay $400, and she thought that was ridiculous to see a PA, physician assistant. It wasn't even a doctor. And when she, I believe what happened when she decided she wasn't going to pay it, they said, well, we've got a financial advisor here who can help you to finance it. How ridiculous is that?
Ridiculous. We'll have to pick that up next break.
Unbelievable. If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. He's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, welcome back. We're always glad to have you here live and being willing to take live calls from all the listeners out there. What's new this week that we need to know about?
Well, what is new is that again, I'm not sure I care to talk about COVID that much anymore, but if listeners want to call and ask COVID questions, feel free. But the Novavax vaccine is becoming available to people, possibly in the fall. And I've got my patients calling to ask me about whether they should get another booster or whether they should wait for the Novavax vaccine. And you might think, well, why are my patients asking me those questions when they know how I feel about vaccines? I think some of the listeners may know more about how I feel about vaccines than my patients do.
Yeah.
So, I'm advising my patients that just as I tell all of you that I would not get another mRNA or DNA COVID vaccine. Now, the Novavax is considered a more traditional type vaccine, but given the way the FDA has been vetting and studying or researching these vaccines, I don't feel safe recommending anything from the FDA related to COVID anymore. So I've got patients that don't care. They just want a vaccine. So I'm telling them to wait for the Novavax as opposed to getting a fourth shot of the standard fare. But again, I'm not recommending, fool me once, shame on me, and shame on all of us. There's no way we're going to have people do that.
Well, I think a lot of people are being led by the restrictions that they get from entry into certain places, be it certain countries or, certain venues, or even maybe your job. I mean, I think that's why people are, they're asking whether or not they're going to be able to be permitted to get into a place without having to prove they've had a booster shot.
Well, the only places, most countries have released all their restrictions, and you can travel freely back and forth between most countries without a vaccine anymore, or having been boosted, or even to report your vaccine status. So the only places that are a real issue is Canada, which we hear about regularly from David, who's stuck there and can't do anything he wants to do.
And he's being restricted from going somewhere.
He can't go anywhere, even within Canada. So the rest of us can go in and out of the United States without any issues. Most countries now don't have any vaccine restrictions. So again, Canada's the main issue. Is our local neighbor that is, not making any changes. And the only reason otherwise to talk about COVID is the mandates for the vaccines, which again we'll consider useless, and the fact that they're being part of the childhood vaccination program, which makes no sense at all.
Did that come into effect?
It's happening.
I mean, does that mean kids are not going to be admitted to school unless they can prove that they've had these booster shots?
That whole thing's a process, and that's where it's going. I have a patient who's been on the show. It's been a long time since she's been on the show, but we can tell her story because it's an interesting story. But her son is 17, who does not want to get vaccinated, and she respects his opinion and desire not to be vaccinated. The state of Michigan sent her a letter on behalf of her son, her 17-year-old son, warning of his health risks of not being vaccinated. So he's had all of his usual childhood vaccines, such as measles, mumps, rubella, tetanus, diphtheria, but he's not had, and polio, but he's not had meningitis. He's not had pneumonia or HPV vaccines, and why, if he doesn't want to, then don't. Why is the state giving a threatening letter to the mother about their kid not getting vaccinated for I'm going to call them optional. I don't know. Again, I never really looked at the childhood vaccine recommendations or orders. They're not really recommendations. They're a mandate until COVID. And I don't understand why we're vaccinating healthy kids for pneumonia or hepatitis B when healthy kids don't get pneumonia or hep B. It's just why.
That's a good question. Is it required to get into school or to be re-registered in the schools?
Is that the problem? It could be. Depends on the school, but you've got to give your whole vaccine record that you've had, the chickenpox vaccine. Who cares? Those are, for the most part, childhood illnesses that you recover from and don't have any sequelae if you get the disease. And you're getting a vaccine. Now I've got to question all of them. Am I in my real life practice? No, because I'm an adult heart prevention specialist and I'm not this is not where I'm spending my energy other than talk about it on the show.
So we don't know then whether or not come fall, whether or not the schools are going to be able to.
Oh, it's happening.
Is it going to happen though? I mean, actually.
Whatever time frame it happens, it's happening.
I mean, what's a person to do if you don't have any choice? You can't stay at home. You've got to be educated. I mean, there isn't any other choice for most people.
Well, like we said, business will fill the void that needs filling. And if schools need to be developed for children that don't want to be vaccinated, they will develop.
Sad state of affairs, and it's going to affect a lot of people. In the meantime, we're going to have to take a quick break. Again, you are listening to our weekly live medical radio show where we keep you up to date on all medical solutions from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to 760 WJR.
Well, you want to pick up on the Siobhan story? Now we're back on Facebook.
We're back on Facebook. So we were hoping that she would pipe in tonight, or,
She still might.
She still might. We'll hope that she'll pipe in and tell us herself. But I thought that it was just amazing. I mean, what kind of help can you possibly get? I mean, there's this book that was written that one of these doctors told me to read about patients at risk. And it's about replacing doctors with PAs. And some of them, unfortunately, don't have some of them take online classes, and they take these. And there's been case after case after case in this book about people that have died by the fact that they were given the wrong medication or an adverse medication, and they lost their life over it
I'm going to. I hear what you're saying, and I'm going to defend. I am going to defend PAs a little bit. So, we just talked about on the show that business fills a vacuum that needs to be filled, and so when the system creates a volume practice where you can't see your doctor, it's 50 people a day, you get 5 minutes. Well, what's the outlet? Well, the outlet is, let's hire an extender. That's the term for PAs and nurse practitioners, which is a physician extender, so that I've got somebody representing your doctor that will spend more time with you. It's not the PA's fault that their job was created because Blue Cross set us on a path that is basically a path of destruction. But and same with nurse practitioners. In some states, nurse practitioners, so can PAs. They can write prescriptions. So it's not their fault that they were, these jobs are created. But if they're not doing a good job, it's because of the doctor who's supervising them, isn't training them and oversighting them and giving them the guidance that they need. It's not their fault that their job was made. It's our insurance system that created generating this volume-based system. And the same thing's going with urgent care. Why would you go to urgent care when your doctor knows you?
Because you can't get in. How about that?
Exactly.
Yeah,
you can't get in.
You didn't leave me enough time to argue back with you now on Facebook, so I'll have to argue with you.
There's another segment.
What is this, segment 3?
Yes. Can I have your water? Thank you. I need more water.
We need more water. Need more water. You'll need more water. If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. He's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, back on you. Are we going to continue on with the COVID vaccines?
No, I'm done.
We're done.
If listeners have questions, feel free to ask. But, I thought we'd talk more about prevention. I think it's time to focus our show and talk more about practical matters and prevention. And so I want to share a story about a patient who I saw today, and we talked about her son and the vaccine, the state sending threatening letters about not being vaccinated. This is a lady we had on the show 3 years ago, when the show started, and she was having atypical chest pain, which is just chest pain that didn't really sound heart related to me, but she went to the cardiologist who did a CT coronary artery, not a calcium score, but an arteriogram. So this is a CAT scan with dye that looks at blood flow. So she gets this test, and the radiologist reads this as totally normal. She has no plaque at all. And the cardiologist reassures her that the chest pain that she's having is not cardiac and that she should never need a statin because she doesn't have plaque. Well, it takes me another year to talk her into a CIMT, because the cardiologist said she's fine.
Does that test absolutely let you see that there is no plaque? Is that guaranteed when you've had that test? It's
Absolutely not.
Right.
The
okay.
calcium, we're talking about the CT arteriogram.
Right.
So the problem with blood flow tests, especially CT arteriograms and even a heart catheterization, which when I was a resident, that was the gold standard for identifying disease. The problem is it only shows what's between the artery walls, not the walls itself. And if you're a regular listener, you understand that heart attacks and strokes are caused by plaque rupture, which occurs within the walls of the artery. So the artery walls will expand to accommodate plaque to maintain flow. And that's been known for like 50 years. That if you've got plaque, your arteries will expand to maintain flow. And this is why people who go and have a stress test and die the next day or a week or month later, and they pass the stress test with flying colors, it's because they didn't have a flow problem at that time. And they had a dangerous artery that is below the resolution of that study. So this lady, we'll cut it short because we got to call her, but this lady a year later agrees to get a CIMT. And what do we discover? She's got a ton of plaque and high risk plaque nonetheless, not just plaque period, but high risk plaque that is totally missed on a standard. I wouldn't call getting a CT arteriogram a diagnostic test. Or a screening test. That's diagnostic because you're doing it because of a symptom.
Right. That's really, it's unbelievable how you just can't trust the cardiologist to give you the right tests or tell you what the tests are that you should get. But you were lucky. She was lucky enough that you were able to find it.
Well, now she's just got to listen to me, and we'll go in the details. You got a caller?
All right, we've got a caller,
Yes.
Ashley.
We have Greg calling from Shelby. Greg, what's your question?
Hey, you guys, Mr. Positive. Hey, Dr. Kolender. I love that you go against the grain. I'm going to change my question, and I love it because you're talking about pliability of the arterial walls, and I think you're alluding to good, vigorous exercise to make those arterial walls pliable. And I just think that people have to understand that you just nailed it. The plaque buildup, the arterial stiffness, and the pliability is what we're looking for so they can expand and contract without fracturing and with plaque buildup. I've done a little bit of research, as you can tell, and I just wanted to thank you because you just really got me, giving me goosebumps there because when you talked about pliability of the arterial walls. But that's basically it, my friend, and have a great week ahead.
Well, thank you, and thanks for calling. And, arterial stiffness is a data point that can identify risk. Now, I don't use that in my office specifically because I think that the other diagnostic tools and lab work that we have is better. So I'm not using arterial stiffness as a risk assessment, but it is available for some practices that use it. I happen to love the CIMT, getting a CT calcium score for those that we need it, and then the labs together tell a story. But the labs don't always tell the story, which is why you've got to get the diagnostic or screening imaging, if however you want to call it, to see the disease that we're treating. So this lady, ironically, has excellent lipids. She does not have high blood pressure. She does not have insulin resistance. All of these things that we look at traditionally as your root causes of disease, she passes all of those, eye tests perfectly. So, she's totally missed by the whole system, not just her cardiologist, but by the American Heart Association, who creates the formula by which we determine risk. And that formula fails all of us.
Well, you see, it's incumbent upon everybody, every listener and every patient to know that they've got to be their own advocate and find out what tests they need to get. But Ashley, you have callers?
Yes, we have Carol calling from Fremont, Ohio. Carol, what's your question?
I'm supposed to go to Australia and New Zealand in January. I had COVID in November of 2020. I have natural immunity, I hope, and I don't want to get the shot, but how do I get into the countries? Do I get a card? Can I get a religious exemption card or some sort of card to get into the countries that are still whacked out about this?
Well, and Australia is one of them, and I have a horrible story to tell you. So this same lady who I've talked about her son and I'm talking about her health, and so she told me that one of her friends was planning to see their grandchildren in Australia because they're from Australia. He happens to be working in the United States. So he gets his booster to go to Australia because they're very strict there and you have to be up to date completely. He dies the next day in his sleep. He gets a booster. So he gets his booster to go to visit his grandkids. He hasn't seen in 2 years. He's dead the next morning. His wife finds him in bed dead. And don't tell me that wasn't the booster. It is a failure of our healthcare system, not just to be demanding vaccines, but that this gentleman wasn't not identified as an at-risk person because he probably didn't meet the criteria set forth by the American Heart Association. Well, I'm digressing. So to answer your question, if you have chronic illness, again, some other problem that, a story could be told that you're not a candidate for a vaccine because of some other health problem, that might work. Or you're changing prescriptions, or you've got a mental health issue, your meds are changing. I mean, all of it's kind of made up, to be honest, but anything you can do or say to get you from getting vaccinated, I would try. But I don't know how to get into Australia, which...
I think you need to worry about getting out of Australia.
Right.
I think you have to think about getting out, and I'm voting for the fact that it's not going to happen. I mean, that's a tough one when you're dealing with other countries, especially that far away.
Right.
So,
well, we may have to pick up these questions until the next segments are out.
This conversation until after the next segment.
Callers, please hold on.
Yeah, callers. In the meantime, we're going to have to take a quick break. You are listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you ought to do to avoid heart attack and stroke, or you have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to 760 WJR. And we are on Facebook.
We're like having two shows. We're having the Siobhan experience told on Facebook, and then we'll get back in the show. So anyway, if you're a caller and you are holding, please keep holding. Can they tell them to hang on or no?
Yeah.
Well, right now, Mark is sending me the callers.
Okay,
because
great.
Blake's not here today.
No, but what about, they have a girl down there.
She's texting Mark instead of me.
Okay, fine.
So,
And then he's sending it to you?
yeah.
All right.
Just so that we don't get digressed, you have 4 calls. So we're going to have to get
All right, let's get, we got to hustle
so I
to
just wanted to tell you, because I didn't have any time to argue back with you, because I was thinking, what about cause and effect? How do you know the guy died because of the booster? You're going to frighten everybody right off the map that wants to go overseas. I mean, you can't really assume.
Just don't go to those countries. Well,
no, but I'm saying, let's be realistic. It doesn't necessarily mean the booster killed him.
No, but you've got to really think about the temporal relationship and the time relationship.
Oh,
you're fine, everything's going good, and then you get a booster, and then you're dead.
Mm-hmm.
And this is the vaccine does generate an inflammatory response. So it does create an inflammatory response. And if you're at risk, then so it's not going to take somebody who's not at risk and kill them. But if you have some other inflammatory issue going on, like artery disease, and you've got a lesion that's ready to go with just one more needle, and that's the straw that does it, well, then it was the vaccine. It could have been the flu would have done it the same. He could have had a common cold. It would have done the same. He could have had shingles. It would have done the same. Anything that generates an inflammatory response. But that's what those vaccines do, is they generate a serious immune response that is inflammation.
Mm-hmm. But what are you going to do? I mean, you don't want to take the chance. Yeah, I wouldn't want to be in Australia and find out that I'm not going back.
Well, I think you can leave Australia, you just can't come in.
Well,
They're happy to get rid of you.
If you can't come in, then what do you do? Just get on the plane and return plane back?
You can get into the United States easily now. They're not checking at all.
Mm-hmm.
But you can't go into Canada, but you can leave Canada. The countries are happy to get rid of you if your vaccine status is up in the air.
Mm-hmm.
The ones that care.
Mm-hmm.
But you're not allowed in.
Mm-hmm.
But I agree with you. I don't know that I want to be in a country right now or ever again,
right,
with such draconian rules that they've ruined that country. I used to think of that country as being like a free-spirited place to be, and they lock down worse than any place in the world.
Right.
I mean, second to China probably.
Well, I just don't think you want to take the risk. I mean, you just never know when you're going through those lines of security what they're going to say. And they might not believe your card. They might look and say, oh, this is hocus pocus. Or
they don't care and they just want to see a card with some writing on it and good to go. I think that's more like what it is. Just a box needs to be checked, period.
Just so that you got 4 people to get through. Okay. So don't be long-winded on all of your calls.
Just rap on the table.
And I'm going to do that because I see you're not looking at me and you're just talking straight out.
We have some COVID ones.
Oh, great.
So.
Well, try to get the other ones that are not COVID. We're done with COVID. Does it tell you what they're calling about?
Yeah, it does, yeah.
Okay, then skip the COVID ones right now.
Skip them. Some of them are interesting.
Yeah.
They might be, but it doesn't.
Just got to take them.
But what about the other ones? They're probably even more.
I'll go fast.
No, you won't. You'll get into Fauci problem.
No, I won't.
Well, I'm going to stop you.
Okay.
Welcome back to our special live medical broadcast on 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about 2 important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. I'm going directly to Ashley because she has at least 4 callers backed up. Ashley.
Yes, we have Darlene calling in St. Clair Shores. Darlene, what's your question?
Yes. Hi. First of all, I'd like to say thank you very much, Doctor, for doing this show. I actually am one of those people that was pro-vaccination. I went and got both vaccines. I've had both boosters. The reason being I have bronchial asthma and diabetes, so I thought I was being proactive. I had, in taking care of myself, I had no issues with the first 2 vaccines nor the first booster. However, following the second booster, I have experienced numbing and tingling down my left arm. I did go into my primary care doctor. She does not believe it's related to the vaccine. I actually went back to the pharmacist, and they said, oh, maybe you'd have some tingling for a couple days. But, this continues since April, and I'm just not really sure whether to go to a sports medicine doctor. My doctor suggested perhaps I have a pinched nerve. But like I said, this was not an issue until, directly following my second booster. And I'm wondering if you think it can be related and they just don't talk about it or report it, or just your thoughts, please.
Well, thanks for calling, Darlene. You cannot assume that it's COVID right off the bat because there's no way to prove that it's COVID. There's just no way. So you just got to go with the common things first. And like your doctor said, a pinched nerve in your neck can cause numbness and tingling down your arm. And so can carpal tunnel syndrome. And that is fairly easy to diagnose, both of them, and fairly manageable to treat. So go ahead and just go the normal route and manage it like COVID doesn't exist, because if it is, there's nothing you can do about it right now.
Just get it fixed. Most importantly, just get it fixed.
Do the normal things.
All right, Ashley, who's next?
We have David calling from Windsor. David, what's your question?
is related, and I know that you don't want to hear about it, but the thing is about COVID-19 vaccination mandate and camp. Many times they seem to be pretty adamant here up in the Muskokas about keeping that vaccine mandate done by the federal government. And it's not the provincial government, but it's the federal government, I believe, that is making it difficult for each one of us, which causes a great deal of divide among those unvaccinated and and vaccinated, which is another topic in and of itself. But the thing is, just being able to go and get and attend a camp without having to be forced to get vaccinated like that. To me, it's just like living in a world of Hitlerian ideas, which I'm not too familiar with. The person, as an individual, should be able to decide on their own, as adults, to figure out whether they want to get that vaccine or whether they don't, and also study the side effects that can come with that.
Well, appreciate your call, David. Yeah, no, I agree with everything you just said, and I'm sorry you're living in that environment, and hopefully Canada comes to their senses sooner than later. I really hope so.
All right. Well, Ashley, let's move on.
Yes, we have Jeff calling from Mansfield. Jeff, what's your question?
Hi, Dr. Kolender. Listen, I'm very concerned about doctors' reaction to prescribing tested therapies that actually work against COVID. I have a polyethylene glycol sensitivity, learned that before colonoscopy, where I almost died taking Miralax before a colonoscopy the hard way. I survived by taking just a teaspoon, but still ended up in a poison clinic the night before my colonoscopy. Those who are not doctors like I am and can self-prescribe, how do they get a physician in an emergency room to prescribe ivermectin, zinc, and a Z-Pack without the headaches and the risks of just dying because doctors will lose their license or their fear of losing their license for prescribing known treatments that work?
Well, thanks for calling. And the good news is nowadays these, Omicron BA.5 strains are highly contagious, but not that virulent. So, it's spreading like wildfire, but not causing that much illness. I'm not treating anybody for anything anymore. I've not found ivermectin, hydroxychloroquine, monoclonal antibodies. I'm definitely not using Paxlovid because it's as untested as any drug I've ever heard of. So I'm not using those. But I agree, back in the day when those drugs were needed to keep you alive, what we talked about on the show then was, and this is appropriate for future reference, is find the doctor ahead of time who's going to help you so you don't have to go to the emergency room and be at the mercy of some random person who will or will not treat you. So it requires preparation. Have the right doctor, interview them, get to know what their preferences are and their feelings about things, so you're not in this situation ever, so that you can call your doctor and get the drugs and the treatment you expect.
All right, Ashley, we have another caller.
Yes, we have Mark calling from Howell. Mark, what's your question?
Yeah, quickly, I'm a type 2 diabetic. I've been working on it for 3 years with low-carb diet, and have improved my numbers a lot. I'm healthy weight now, but I'm paying the price for years of eating wrong. So I had a calcium score done the early part of this year, and it was like 2,600, extremely high. I did have a stress test done after that, and I know that's not necessarily exactly what to look at, but it was fine. And now I have a CMT coming up in 2 weeks. My question, and I'm taking a low-dose rosuvastatin from an anti-inflammatory standpoint. So I'm doing a lot of things that are right. I'm pretty darned healthy for my age. And my question is when I get the CIMT done, my thought is it's probably might be a lot of plaque, but it's more on the stable side and not the liquid side. We'll see. But how much reversal can I do with, additional supplementation of, omega-3s or some different ideas to try to reduce that? How much of that plaque can kind of be reversed a little bit or in reasonable amount?
Well, before we stop, feel free to call back in a few weeks when you get the CIMT results, so we can talk with more substantial data. But getting
Well, I actually am seeing a doctor, a prevention doctor, that's in the similar group that you are.
Oh,
So
great. Okay,
I should
good.
have
Well,
good
you're in good hands then. What I would do, well, first of all, getting a repeat CT calcium score is useless. It's not a great way to measure progress because the number can fluctuate and that number no longer represents like a change in your risk. It just doesn't work that way. It's really about identifying plaque and then moving forward. Getting another CT calcium score is not going to gauge your risk, but you can expect to, there isn't any reason you can't expect to fully heal your IMT numbers, whatever they may be, and reduce your risk for heart disease. And we've got a patient in the practice with a similar story to you, and we're going to have him back on one of these weeks just to say, hey, where's your progress to date? But he's only on a low-dose statin and nothing else. And we've reduced all of his plaque and IMTs to normal, but I'm not repeating his calcium score. It's not going to tell me anything. But yeah, you can improve your risk.
With medical management.
Right, medical management.
Absolutely. Well, good luck. Anyway, in the meantime, we're going to have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing tonight and you'd like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to 760 WJR.
So we got through 5 calls.
Yeah, you
did. We do
did.
okay?
I thought you did pretty good, but Dave, we already had his questions, so I'm just saying, it's kind of like there's nothing you can do about it. What can you do about it? You're stuck in a country where they're not going to move on the restrictions, and it is what it is. It's just almost, it's not that it's the same thing here, but we have our own restrictions here.
Not like there.
Well, not like there, but what are you going to do?
Don't. Right. Well, just commiserate. He's calling to share his frustration about not being able to enjoy his annual vacation.
Mm-hmm.
And we're all have had or have those issues wanting to go where you want to go. Like, I don't know why anyone would go to Australia with their laws right now. You go, but it's right. It's like saying you just don't want to end up in a country where all of a sudden they're going to shove everything down. The airlines are shut down and you're stuck.
Right.
We've heard of people like that who, I met a doctor from Colombia in Miami, in the beginning of COVID. I don't know if you remember, we were talking about doing something with her in Florida, and because she left Colombia to visit her mother and Colombia got locked down.
Oh my God.
So she's locked out of her country for a year and a half.
Oh my Lord. Yeah.
And that's it.
It's unbelievable.
You're
isn't it?
stuck living out of a year and a half because of COVID.
Wow. A lot of people were locked in different places. There were people in Europe that couldn't get back, people in Italy, but not for that long, but still.
So yeah, it's well, you just got to make those decisions. And if you don't want to be vaccinated, why plan a vacation to a place that's been as locked down as any place on earth? Just go somewhere else.
Mm-hmm.
You certainly can't go to New Zealand either. They're if they actually are worse than Australia.
Mm-hmm.
But plenty of good places in the world. I think Europe has just opened everything up. All of Europe's open.
Well, that particular case, that one caller was going to visit relatives or something, I think. So they were going for a different purpose, not, for the fun of going. That's
right. Well,
that's a little bit different, but certainly it's I don't know. It's hard to know, but I just don't think that. Do we have figures on how many people have died from the booster shot?
No, because the FDA is still withholding that information despite a court order to release it.
Okay.
So we have the information of like 3 months, but that's it. Then it stopped. The flow of information stopped.
Mm-hmm. So nobody really knows about the safety or the numbers or what the risk is.
Well, we know that based on what we've already has been released, that the safety is beyond the normal allowed criteria. So normally you have 50 or so adverse events and a drug is pulled. And in 3 months, 1,200 people died, and all they tell you is it's safe, keep going. And that's recognized by Pfizer and the FDA. So yeah, that's why I'm not recommending any more vaccines, boosters, or additional vaccines that the FDA has approved. I got to really question them.
Welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR. On the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957.
Yes, AnnMarie?
What happened?
Nothing. We're good to go.
Are we ready to go?
Show's on. No, it's the clock's ticking.
Okay, I thought that we had some kind of...
No, we're good.
Okay, so...
Just Ashley panicked.
Okay.
Sorry.
That's okay, Ashley.
I thought it was the wrong time at first on there.
Right. She looked at the clock instead of the timer.
Technical problems here. All right, so we're back.
So we're back. People still have COVID questions, which is, the shame is that trust has eroded in the system. When you can no longer trust institutions that are supposed to be beyond reproach, then, we have issues. And the only reason to talk about this again, in my mind, is because these same institutions are the ones that are keeping you from getting true preventive care. The tools are available, the methodologies available. We just live in a system where there's got to be a pill for every problem. And you should be on every pill in the world because you have every problem in the world. They keep lowering the diagnostic threshold for everything. So that's our problem. When prevention, like Greg said, is possible when you pay attention to lifestyle.
Right.
Now, granted, it's not just lifestyle. You need the guidance to tell you what to do. Like, again, this lady I saw today, bad inflammatory artery disease, at risk, normal lipids, normal blood pressure, no insulin resistance. What do we tell her? I'm on a hunt with her to find the hidden drivers of disease. I strongly suspect she has sleep apnea. We've looked at her oral health as a non-issue, and she may have some other genetic related issues that are putting her in this situation. And when most people hear the term genetics, what do you think?
That you inherited it from your mother and father, or somebody in your family.
But what does it do for you? Like, I think, how does it make you feel about your fate?
Well, I think that a lot of people just think that, genetically speaking, if I'm going to inherit it, I'm going to inherit it. If, mother and father and their grandparents all died of a heart attack, then people take the doom and gloom position that, well, that's in it for me as well.
And that's what I hear from patients. They either, want to assume that they're going to be okay because they have some positive behaviors, or they resign themselves to some early death,
right? Because
it runs in the family and I'm doing all that I can do. The idea that you could do simple testing that identifies your risk, creates a plan to avoid this path, no matter what your genetic outcome is.
Right.
So genetics does not mean that you're on this unwavering path. It just means that these are signposts.
Right.
And I've got patients come in and they go, how did I do? It's not how'd you do, it's how are you doing? And these are just places to make adjustments in our plan, places that we learn more about you so that we can make recommendations about changing your lifestyle, how you exercise, how you eat, how you sleep, how you manage stress. And those are all factors that are foundational to prevention. But again, they're not the whole thing.
But see, I always come back to the fact that you have to have a shepherd. You have to have a doctor who is going to be like you are, on top of the case 24/7. I mean, your patients have, easy access to you. They're texting you, they're calling you over the weekend and the evenings. You're watching what they're doing, you're following up on their care. It's not the same thing all over in other offices. And that's why when we were talking about PAs earlier, not everybody's got a doctor that's sitting on top of the PA, making sure that the patient's getting the right care.
Well, that's in a different environment. That's a high volume environment where the doctor's seeing 40 people a day, the PA's seeing 20 people a day, and that seems like a lot of time to the listener.
And a lot of stuff
It's
can
still
fall
not a
through,
lot of time.
a lot of stuff can fall through the cracks.
So I'm sure there's all kind of horror stories about PAs doing this and that, and there's all kinds of horror stories of doctors doing this or that, to fill a lot of books. None of those books answer the problem and give a solution. And, so we're giving solutions here, which is the tests that you need, the labs that you need, and the processes that you need to take into put into play to put yourself on the path to health. And yeah, you need somebody to shepherd you down that road.
Yeah, but as you've said many times on the show, there are not many places that offer and do the CIMT, which is kind of the gold standard test to find out how much plaque you have and how serious the plaque you have is. Let's supposing somebody gets a prescription, gets a CIMT, you've always said it needs to be interpreted by the right person. And then you have to take action beyond that.
And this caller that called, I'm kind of hoping he's seeing one of my associates in my office. I don't know who he's seeing that's, doing CIMTs, but we know plenty of offices that do, I can't say plenty. I just know that when I've seen other people get CIMTs, their recommendations are still very pedestrian and not geared toward recognizing the data that they've had collected to put on a path. Although that caller did seem very well informed.
Oh, yeah, no, he seemed as though he was on top of his game, but that's like very rare to get a caller like that. But, we had the caller before had a CT calcium score of 2,600.
Well, that's what I'm talking about.
Yeah, but I mean,
he's getting the same.
But yeah, right. But I'm just saying, at least he's staying on top of it.
Right. Well, he went to get the test.
Right.
It's scary. If you get 1,000. Well, what we did not talk about to him, because we ran out of time, is that when you have a calcium score over 1,000,
right,
you have a higher risk of all-cause mortality.
Mm-hmm.
That means you are at a higher risk to die from any other cause
mm-hmm.
than the normal population, which is very scary to me. And you just got to stay on top of every little health thing that you come across, and you can't
mm-hmm.
ignore any symptoms about anything.
Mm-hmm. Well, I was also actually thinking about a call we got a few weeks back, or maybe a month or so, where a caller called in and it was 2,500 his score was. And then he's like, what do I do with this? He got the prescription to go, he got the test, and then he's calling in asking you. And you're like, okay, go straight to the hospital.
Well, I know I wouldn't tell someone to go straight to the hospital unless they were having chest pain.
Right.
Well, the number is really just screening for disease and recognizing that they have that disease.
Right.
If you're not having chest pain or shortness of breath or symptoms that are very suspicious of angina, heart disease, then you don't need to be in the hospital. You need a medical workup.
Right.
But that caller you're talking about was a while ago.
Mm-hmm.
His doctor told him repeat the CAT scan,
mm-hmm.
which is an utter waste of time and represents a total lack of understanding of how to manage prevention, which I hate to say it, very few doctors know what to do.
That's a sad state of affairs, though.
Well, they don't, and it just keeps going on and on. I mean, we can talk about this forever.
mm-hmm.
Just what's going on in this healthcare environment. It's a joke.
Mm-hmm.
So
you
that's
have
why we're here. Educate you about what to do and put you on the right path.
Be your own advocate and make sure that you get pointed in the right direction, get the right tests. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you've gotten some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Please continue to tune in to our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to 760 WJR. Good night and be well.